Hello, my name is Sabina Schaefer, and today I'm going to be demonstrating how you would collect a set of vital signs. First, you're going to go into the room, sanitize your hands, and then you're going to introduce yourself to the patient and tell them what you're going to be doing and get the patient's name. So, hello, my name is Sabina. I'll be your CNA today, and I'm going to collect a set of vital signs. Can I get your name, please?
John Schaefer.
Okay, and then you're going to confirm that with your chart. And then you are going to start with your temperature, and then you'll get your pulse, and then you'll get your respiration rate, and then you'll get your blood pressure. So starting with your temperature, you're going to have a oral thermometer. You'll put the cover on the oral thermometer, then you'll stick it under the patient's tongue, and make sure the patient can follow instructions, will know not to bite down on the thermometer and all of that stuff. Then you'll have the patient close their lips around the thermometer, hold it there until it's done, and then you'll take it out, record your findings, and then move on to pulse. When you're doing pulse, you're going to take your index finger and your middle finger, put it on the radial artery on their thumb side, and then count for 30 seconds. You'll multiply that by 2, and then you're going to move into respiration rate, and then you're going to count the respirations for 30 seconds and multiply that by 2. So I'm going to do that real quick. Can I see your arm, please? Okay, so I'm going to record my findings in the notebook. And so for 30 seconds, his pulse was 40, so you multiply that by 2, so his pulse is 80. And then his respiration rate for 30 seconds was 8, so that's 16 for a minute, which are both in the average ranges. And then after that, first you want to make sure when you're feeling for the pulse that it's strong, it's not weak or thready, and it's not like bounding, and you want to make sure that it's regular and normal, and you want to make sure, and if it's not, you're going to count for a full minute instead of 30 seconds to make sure, so you have the most accurate reading. And then same thing with respiration rate. If they look like they're having trouble breathing, or if it's super wheezy or winded, you're going to count for a full minute instead to make sure you have the most accurate representation of their vital signs. And then you would move on to blood pressure, and I don't have a blood pressure cuff or a stethoscope, so you'd make sure you put the stethoscope on correctly, make sure it's all sanitized and everything, tap it to make sure that it's on, then you'd take the blood pressure cuff, make sure they're sitting in a relaxed position, they haven't been doing a lot of strenuous activity previously for about 5 minutes, put the blood pressure cuff up on their bicep, and then you'll make sure you'll get to their brachial artery. You'll find it on the pinky side of their arm. You'll put the stethoscope right on top of that. You'll inflate the blood pressure cuff until about 160, 180-ish, and then you'll slowly start to let the air out. When you first hear the sound, that is your systolic sound, and then the last noise you hear is going to be your diastolic sound. So an average blood pressure would be about 120/80, and yes, it will vary from person to person. So that is how you collect your vital signs on your patients. Thank you.